Okay, so the topic of mine is how to become the experts in thread lifting. But first of all, I would like to how we say to disclose first that I'm not the expert just yet. But working in the academic institute, we had always come up with this strategy to make people expert in some way. And I believe that, with this talk, even though I'm not mentioning any of the technique, but the other two speakers will tell you about the knowledge and the new techniques. But for me, it's more like how you become the expert in each of procedures. And again, I will mention that about the result of the updated study along the way. First of all, the expert at anything was once a beginner. So, you have to start somewhere. You can't really born expert. So don't worry about the skill and we can always develop ourselves into proficient in something. But for me, in learning in medicine, I think, there is a steps you had to get knowledge acquisition. And once you start attending this webinar or TESS talk, you already gaining knowledge from learning from the expert now. After you know what it is, you have to proficiency your skill, your decision making, and thinking about what to do and how to treat your patients. Then you go in simulation in a team. And last but not least, you have to get clinical experience, your real experience that really, really help working on the skill. However, it's not like a ladder. It's more like a circle. So when you experience in something, you may need to acknowledge or acquire the new knowledge that is coming. For examples, like me, I'm doing lasers, injectables, Botox filler for a long period of time. But, it just recently in the last 5 years that I'm into the thread thing. So, you can always learn new things and then incorporate to your previous practice. But, before becoming sustainability expert, you have to go toward the path. You have to pass Mount of Stupidity and Valley of Despair before going to the top of the mountain, become a guru. And for those of you who know this in learning, I would like to introduce you the Dunning-Kruger effects. So this is the effects and the phase that you may pass during the learning and become expert in anything. So look at these. For those of you who don't know that, allow me to explain. So see, in the x-axis, you go from know nothing, and then wisdom, and then become guru. So it's here. And then on this y-axis, it shows the level of confidence. And again, you can see that when you know nothing, this is the new technique. You watch and you look at all the expert doing procedure like thread lifting. You think it's I might not be able to do it. But once, if you don't know anything, but you just try it, you will feel like it's super easy because you don't know complication that might occur. But, for a period of time, when you do the operation and then you had a lot of complication happen, your confidence level might be going low. And again, let me simulate it into thread lifting experience with the Dunning-Kruger effects here. So at first, you start being not knowing anything. So it might be something that you ask yourself, oh, what is the thread lifting? I don't know. I don't want to do it. And that is there where you start. But when you start knowing about that, you see how fantastic thread lifting is. The result is so good. And then you said, oh, it's super easy. I got it. But that was when you were at the mouth stupid. So, you just know it, you think you can do it, but the knowledge is actually just right here, very little, but you had confidence too high. And that happened to us all, don't worry about that. It happens when we know nothing, but we think that we know a lot. So that is, we pass the peak of the mouth stupid. But of course, when you do it and you think that you can do it, you may experience all the complication. So now you are going down to slope and wait, it's very tricky. And then when you know a lot more and you develop your skill, you start knowing that all complication that might occur. So now you become, oh no, it's too difficult. How can I fix everything? I know that we all pass that path. And some of you who are coming new in thread lifting, and when you are at this point, some of you give up. because you don't think it's always lump and bump. It doesn't give you a good result. Complication is a lot. But let me show you here. If you keep doing, acquire, learning, if you really want to become the expert, just go through the path here, slope of enlightenment. When you learn a little bit more, little by little, practicing more and more, you gain more of the confidence. You gain more confidence in doing thread lifting. And then, like, you start feeling like it's not bad. I like it. And then you practice it over and over, simulation over your team. And then now you can be in the plateau of sustainability. So you become a guru. And I'm thinking like this is where the path that you are going. But of course, everyone needs to be beginner first. So acquire the new things, like, pass all the amount of stupidity, valley of despair, and then you one day will become the expert or guru. In this particular point, like, I call that the learning curve. So you start from don't know that much, feeling despair, but of course, keep learning, keep doing, and then one day you will become the expert. And I call that the learning curve. So, sometimes there is exponential phase that you need to exaggerate. So which means you practice more, learning from the expert and practice it by yourself. Keep doing and doing, you will become a very good one day. However, sometimes learning, you need to get reboost. So, like anatomy. So the first time that I attend the anatomy course, so, everything's like new, open my eyes and my ears. I think I remember everything. But after 7 days, 60% of my learning new thing is gone. So I start like gaining back to cadaver workshop again and again. And same thing with thread lifting. You may need to get like one more webinar. Next week, next month, you come to another TED Talk, learning another things. And then some of the speaker will repeat what you learned already, and then you remember. So this is what we call the effect of repeated or re-exposure experience. And then now you can learn and keep yourself booster all the time. And again, chasing your dream requires persistence. This is how we can become the expert. So we need to keep learning new things, keep practicing. And I think one day that is the key for the expert. And then let me get back to the circle of medicine. And then I will adapt it with our knowledge in become a thread expert. So first, knowledge acquisition. For example, you need to know how many type of PDO thread that has been on the market. There is floating, there is barb and non-barb. And different type of thread can give you different result. So if you really know what it can be done, you will know and how to pick the very good thread and technique to your patient. Don't forget to look through all the publication, like, the overall outcome of PDO thread lifting. So you know that it's safe and effective. However, it depends on type and depend on the technique of the doctors that performing. And last but not least, you find the evidence base to show that what thread's doing underneath the patient's skin. And this is one of the very good examples of the paper. And last but not least, learn about the outcome and complication that might occur. There is a lot of good review paper out there that I already posted. In summarize, there is a lot of paper, but this is something that I'm giving you from reading tons of paper. First thing first, the PDO thread can be used for facial rejuvenation, but depend on the type of the implant. So, some can stimulate collagen better than the other. And collagen stimulation can be seen really, so it proves in histology. However, in terms of using PDO thread for lifting, you need to get a very, very good thread to provide you a short-term improvement in terms of mechanical lifting. But the ingredient of the thread itself can also helping you developing your own collagen along the way during the degradation process. So that should be the thread that you're looking for. And the complication that might be occur, you have to learn it too, to treat it, to prevent it, and to tell and informing the patient. I will show you all the pictures of the adverse reaction. But again, do not stuck in the valley of despair by seeing all the complications, because from time to time, when you learn more, you can prevent all those complications and then can treat that as well. And last but not least for me, I think the ideal thread lifting is now it should provide a strong mechanical lifting for short term at least. The patient should see something and then stimulate the collagen along the way. It should have less puncture site to reduce the chance of getting infection. And lastly, it should get approved by FDA. And then skill proficiency. So when you know everything, you know the thread, you know the technique, now you have to find a way to train yourself. And like this, like my personal experience with thread lifting. And as you may know, I'm the newly prof here in Thailand. So I had my passion in research. So I always use the research to prove either of modality is efficient. And also, I also train my hands and my skill during conducting studies. The very first study that I have been participate in thread lifting, it's happened like years ago with another brand. But this is something that I would like to show you that the different type of ingredient can stimulate and may be suitable for different type of patients. And look at this, the good thread, this is what it should be. So it provides a strong mechanical lifting for a very beginning. And you can see that the improvement starts showing. At 1 week looks so good. And then now 2 months, very good. After degradation, it starts sagging again. But at 6 and 12 months, it can, improve your laxity. That is because of collagen stimulation over the period of time. So I think with thread lifting, we had a long path to go. And here is the other examples. Lastly, in different area that can be treated, like submental area, it's already been proved. So now I'm into thread. And then I have opportunities as our moderator, the very handsome one, informing you that I'm now into the studies that has been conducted 2 months ago. But today I have the result for at least a month to show you. So this is during the study, I had one of my beautiful fellows working with me, and this is her. She is the one who spearheaded the project. And TESS Clip Soft is a mesh suspension PDO thread, so which will be absorbed and disappear after at least 6 to 8 months. And this is how it's going. I'm not go over that because every one of you now here should be know that what is the character of the thread. But what we are doing is we bring in the patients. I use all my fellows to come and help treating the patient, and we follow up the patient. And again, come to the decision making. Decision makings mean when you know the technique, you know how to do it, you have to pick the very good choice and the best way to your patient. And that is the same thing like what we are doing. So, in previous studies that has been conducted in Korea, the aim of that study is for mid-phase lifting. So you can see how we insert the thread in that studies from Korea. But now we looking for lower and maybe submental area lifting. So that is how we make a decision to insert thread different from the previous study that has been published. So I think that is how we test our skill. So we decided to insert somewhere. And I think for thread, this is very important because with the same thread, but different angle, different insertion point can give you different effects. You have to make a decision to make sure that you proficient your skill enough. And this is our decision to treat in all the patients. Again, this is examples how we are doing this. So we get the patients in, we draw the lines and make sure, and then we insert along the way. And you can see the improvement. So here and there. This is just only the immediate result. Okay, here, let me lean it back. Again, this is on the other side. You can see that with this technique, it can really improve lower face and including submental from just less than 5 thread per side. Again, immediate result. I'm already showing you some, but this is another examples, and you can see the patient really get a very strong mechanical lifting at the very beginning. Definitely some patients swole and had redness and bumpy in some of the patients, but all the complication is not last longer than a week. But some of them, like irregularity or dimpling, can last for a month. But this is acceptable when comparing to something that the patient get. Look at her submental area now, here and there. And the dimpling that I mentioned is sometimes look like this. I will show you how long it lasts after this. Okay, here. And the side effect, as I mentioned, you know, dimpling, it can occur. I think that might be because in these studies, you know, we have a new fellows coming in and then we train along the way. But of course, even these, the patient is still very, very happy. We can see some visible thread when we insert too superficial or redness. So see, this is the examples of the lump, the visible thread, again, redness, bruising, it can be seen easily. Of course, this is another dimpling. But how long the side effect lasts? This is something that we prove. Mostly all gone in a week. You can tell your patient to get into the thread lifting that, you know, usually 90% is gone in a week. But the dimpling is something that go last. And you can see from this that in my patient, almost invisible at 2 weeks, but to make sure it's gone in a month. So this is the show, this photo that we can show our patients, like, you know, if they can accept the risk of having the complication. Again, this is another patient who had lump and bump, and it's all clear within a month. Another patient, again, see, dimpling, this is gone by 2 weeks. How about 1 month result? You know, everyone know that it should be good, but again, for me, I'm looking forward to the longer term result. But to show you with the photo, with the color, and you can see this is the vectra. For those of you who are not familiar, the area that has been in blue, it's increasing volume. But the area that has been shown in orange or yellow, it's decreasing the volume. And you can see in all the patients from that, you can see that the volume shifting redistribution from down here up to the cheek where we are using the thread. So which means along the time, you know, the improvement is not actually reduce the volume only, but it redistribute, shaping up on the area that we should have the volume, like in mid-face. So you get like 2 birds in 1 stone here. And the effect so far, still up until a month, we can still see the decreasing volume here and increasing volume up there. So I can't wait to see more longer term of the result. And this is something that we've seen in all the patients in the studies. Okay. Again, longer term of results still continue. So I keep my finger crossed, hoping to see what's good come after TESS lift, thread lifting. And then last but not least, I would like to share with you is this is how we proficient. So we simulation in team. So as you may know that I had a lot of fellows, beautiful people working around me. You have to simulate it in team and sharing clinical experience. So, you know, some of them might have better technique than us. And then if you learn in group, you learn better. So what we have here in Thailand is the cadaver and hands-on workshop for thread lifting, which I'm not only host this for my student, but I also host it for other doctors, other Thai doctors who want to get proficient in hands-on. And then we had cadaver workshop. It's all one day. Cadaver workshop in the morning and hands-on in the afternoon. And this is how it's looked like. So at first we went to the cadaver. We had to center the cadaver and also the training skill. And this is all the team of my fellow that has been past all the training. Okay, in cadaver, like, you know, for training for 20 people, what we do is we had like 6 cadaver for 2 participants each. And then in the morning, we giving them lecture, and then we had the cadaver workshop, try 2 participants per 1 cadaver. So each of them can get like 1 half face lifting. And then we had a group of facial analysis in the real patient that they will have the hands-on in the afternoon time. So facial analysis means they analyze the area that need to be fixed and design the thread. So I think that is a very good experience that we share in simulation. And again, this is the examples of the cadaver and how I give a talk in that lecture. And in the afternoon time, again, each individual doctor had one each of patients, so they can do like full face thread lifting, like in real patients. We divided them into group, and then we had like, you know, teacher and teaching assistants coming, and this is how we are doing. Like, we really do hands-on, we do facial analyze. And luckily I had a very expert from TESS Lift Thailand team. So, they are all coming and help me whenever I would like to. So I feel so thankful for the TESS Lift Thailand team, the Eden Colors, for always helping me in anything. And that is why, for me, I think to teach is to learn twice. Every time I host a workshop, I learn new technique. And sometimes even I learn from the students who's coming. So keep learning and keep teaching really help you become the expert in thread lifting. And I think now we can do it. Anything we can. Thank you very much.